okay? And I'd like to say extend your knee, but some people don't even know what that means. So say bring your foot up. Now, the thing that he could be doing, though, is he could be compensating, so I should actually have my hand here. Okay, bring your foot up. Now, for flexion, do I tell him to bring his foot down? Why not? Yeah, gravity already does it. So, you know what, I'm going to have to turn him over for that one. All right, so you can wait. I won't do that right now. We can do that, okay. And so then I need to do passive. So I literally have to hold here and pull up. And then again, I'll have to turn him over to do flexion because the table's in the way anyways, even if I could do it that way. And then resistance, I have you push against my hand. What's the other way I could do resistance? Anybody remember? Starting from end range of motion. I don't like doing it this way, but you could be up here, say, okay, don't let me push you down. But I really like the other way better. So I have him push up. Now, some doctors real quick, okay, just pull down like this. But that's really not the way you're supposed to test flexion. You're supposed to have them turn over. So we'll have you do that. But there's one more, and that would be the sartorius. So the way you isolate the sartorius is you take one leg here, you take the other one, you put your foot here, and I want you to slide it all the way up your leg. Just bring, no, I'm sorry. Take this one. See how hard it is? You got to actually say it right. So I want you to take this foot and bring it up to here. Okay, that's the sartorius. Everything that that muscle does is in that test. So whether it's the abduction, everything it does in that test. So you basically, that's you only, for this test, I will only have you do it actively. I'm not going to have you do it resistively. So bring your foot all the way up. Okay, that's it. Okay, now turn over on your stomach. Now let me check his hamstring. All right, bring your foot to your butt. Good. All right, and then I'm going to do it. See how far it goes, and then okay, now bring it up and do that. I could have him bring it here. Relax. That really didn't bother you.
No, I'm just cramping right now.
Okay.
Oh
I mean, again, some people have it here and they say, okay, don't let me push you down. But I like, let's just do it this way. It might be easier. Okay, so that's testing hamstrings. So now we've done all your range of motion. So in your test, if I said one of your things is knee range of motion, you literally would do, that would be it. Okay, you'd be done in a minute. All right, now turn back over and we'll test later. Okay, so I'm going to have you scoot back. Bend your knee. ACL. You haven't had an ACL in here. The best way for me is to actually kind of like sit on this, and that's how I'm stabilizing this. Otherwise, if I was pulling here, his foot would just keep slipping. If I stabilize this, I grab this. It's just like opening a drawer, just like the ankle. I grab this and I pull forward. Okay? If this comes forward, then he has an ACL. Now, you see where the hamstrings make a difference? Person has really strong hamstrings. You see where the hamstrings come? They come right here. If he was tightening his hamstrings while I was doing it, it wouldn't go anywhere because the hamstrings attach right here. Does that make sense? Gotta get that in your head so that you don't have to so much memorize, but you can just do that so this way. Now, you know what? I'm probably going to have to do the other one because they're all over there. Let me do this one. Okay, so the Lachman test. You saw that if you lay back. Okay, don't fall asleep. Okay. Now again, anything with a straight knee is most likely not going to work because the bones are holding it together. So I'm going to slightly bend it. Now, if my hands were big enough, I would grab this. You remember that picture? And I grab this. I pull forward like this. I'm holding this and pulling this. So you see, that's good. But let's say my hand isn't big enough to do this. I can actually put my leg here because I still need to keep it bent. My leg here, hold it here like this, and do that. You see, so I have a chance now with this. So the Lachman test is better, and because I can't get my hand around his thigh and keep it bent at the same time, I can keep my leg under there and pull forward. So that's all I want you guys to do. Is I want you to, you can show me the drawer test and the Lachman test, and that's fine. Now posterior, like I said, he just bends his knees, and that's where the other one comes in handy. So come on. You saw what the guy looked like, okay? If it falls back like this, and this one's where it is, then he's torn his PCL. All right? Fortunately, he didn't do that, I don't think. Yeah. This test right here, which is opposite of the anterior, it really just isn't a great test. This is like gravity do it, okay? But PCL is that way, so you got to tell me you can do that. The other SAG test is when you bring both legs up, bend them, and I just see if they drop this way. Kind of hard for me to do this and see it at the same time, so I usually have somebody saying, look, do you see one of these lower than the other? Then we know. So there's 3 ways to test the PCL. The SAG ones are better than not. Okay, MCL, right? If I were to do it like this, I don't care if you have an MCL or not, it's locked in, nothing's going to happen. So I have slightly bend it. So you must make sure you slightly bend the knee when you do this. You saw there were different ways. You had the one guy stick it his leg underneath his armpit. That's a lot of orthopedic surgeons do that. I don't, because it doesn't really work too well for me. I'm not big enough. But so I can pretty much do it slightly bent and just go like this. See what I'm doing? I'm trying to open this up. Testing the MCL, slightly bent, and doing this. The other way, like you saw on the thing, is if you slightly bend it here, because the leg's too heavy for me, I can do it that way too. That's a little easier on a really heavy leg for me, okay? That makes sense? Okay, LCL, do it on this one, it's just easier. It's the same thing. I slightly bend it, and I go this way, okay? You see how that moves a little bit? But that would be testing that. The muscles aren't going to hide anything on this because muscles don't hold your MCL or ACL, or these two at all. They hold the posterior cruciate. The quadriceps will keep the posterior cruciate from falling down. Again, remember, I'm going back to that, but remember how this would sag? Well, this muscle was holding, it attaches right here. If it was holding really tight, you wouldn't see the sag, even if there was a posterior cruciate test. So the quadriceps help the PCL, and the hamstrings help the ACL. Does that make sense? Because they're doing that. Okay, so what's next? So you've seen all of these tests. Oh, so you're, okay, tib-fib translation. That's the one, again, hard to do unless somebody really actually has it. And then you're literally grabbing the fibula right here, and you're trying to move it. It means this ligament's torn. This ligament's torn. Me just sticking my fingers here is going to hurt them. So I don't know if I'm ever going to be able to move it. But that is a test, and you should know. But we hardly ever test for this. If we touch it here, it usually hurts too much. And your perineal nerve's right here too, so it'll cause them a lot of pain. Everything will go numb. But that's the tib-fib test. You're basically just trying to separate those two bones. Okay? And then, okay, tilts. So basically, kneecaps. You always check them so you say relax. If you don't relax, then it's not going to move. And you go that way. That's lateral, medial, up, down, tilt, and tilting this way. Tilting this way. Kneecaps really move. A lot of people don't know their kneecaps move this much, which surprises me because I think everybody does. But so we just see how it's moving. We also see if there's any pain under it while we're doing it. Okay, so that's the patellar test. Neural, you just say motor sensory reflex. Okay, so the last few tests, it's not really, like I said, it's not really McMurray. I got to change that on this thing. But basically, this is the test I want you to do for the joint. Okay, so what do you think's gonna? Okay, so they tell me they hurt in here. If I go ahead and grab their foot and do this on them. See, McMurray's goes farther, and it kind of sees there's like a sign in there, but this, if I just do this is all I want you to do. See how I'm turning that? I'm smushing this like crazy. If that cartilage is hurting in there, they're going to feel it. So I smush it, and I turn it. And I see if there's any pain in their joint. If they say there is, then I'm worried about some cartilage or something else going on in there. That's that test. Athlete's compression is, okay, this is athlete. He has some shoulder tests, and he also has some knee tests. I don't love these, but I need to have enough tests to turn over. This is an easy one for you guys to do. Okay, so this is what athlete decided to do. He decided to kind of hold your leg here, grab this, and this is how he checks cartilage, as he pushes and turns. So you saw how I pushed and turned down there? So this is compress it and turn. Is that hurting? I just don't like this test at all. And then athlete's distraction was to pull the leg up like this and turn it like this to pull on the ligaments. So I'm going to decide whether, if I can get enough points in your test without doing this test, I really don't like it very much. But you see, so now I'm pulling these apart, and I'm turning it. Those are testing the ligament, and compression is doing that, testing the cartilage. So if you compress the joint, you're testing the cartilage. If you're pulling on it, you're testing the ligament. Okay, then we need your IT band, so we need overs, so turn over on your side. So face that. Okay, so anybody remember? Slightly, this is his IT band. Do you have a tight IT band? We'll find out in a second. Slightly bent, and I let it just drop. It's a little tight. See, it should be touching the table. You gotta work on that. Talk to your trainer. So, is it better on the other side?
Probably not.
Okay. So what happens with him, or what could happen, is that he could start getting tendonitis down here or up here because it would keep rubbing and popping. And that's not good because then your knee gets inflamed, you have the problem. So, like I said, in the old days we used to just do this until we got it down to the table. All right. Now he wasn't made to do that, but most people should be able to go a little farther. The other thing he would do is he would lay on this side on the roller and roll up and back, and just let the roller just keep doing this on him until it loosens up. So that's the Overs test. So good, thank you for doing a positive test for me. And then apprehension. We got one more. Turn over. Straight. Okay, good. Lay down. Apprehension. Okay, which way does the kneecap go when it comes out? Laterally. So I'm going to go like this. Relax your leg. I'm going to go like this. If he screamed or kicked or did something.